Welcome to a Review Renew ACLS tutorial. This topic results in BLS concepts. We're going to talk about the initial assessment as we get all of those steps in order. The first thing we always want to do is check our patient for responsiveness. If it's an adult, tap the shoulders, use your voice, and loudly project, "Hey, are you okay?" You may use the patient's name if you have it. If it's an infant, it is suggested that you use the bottom of their bare feet to tap the infant, and you can also use their backside. But in most cases, people will respond to their name. They will respond to sudden loud voices, and the idea here is to determine, can your patient respond to you? So we're going to check the patient for responsiveness. If your patient is unresponsive, it is now time to call for help. If you're within a hospital, do not hit the code button yet. You can make a general announcement and say, "Hey guys, my patient is unresponsive. I'm preparing to check for breathing and pulse." If you're outside of the hospital setting, now is the time to call 911 and direct someone to get the AED. After you have alerted for help, now it's time to check for breathing and pulse. We do this simultaneously. Using 2 to 3 fingers, place your hand on the side of the upper neck of the patient. Place your ear directly over the patient's mouth with your eyes scanning the chest. You have 5 to 10 seconds to determine if you have a pulse or not. You also are listening for breathing during this time. Chest should rise, and that's how we determine if we have breathing. If you do not feel a pulse or you are unsure if a pulse is present, it is time to begin CPR. Let's put it all together. The initial assessment, your job is to check for responsiveness, call for help, check for breathing and pulse, no more than 5 to 10 seconds. If you do not have breathing and pulse, or you are unsure about breathing and pulse, it is now time to start CPR. Thank you for joining us on this tutorial of basic life concepts for the initial assessment. Thank you. You can contact us for anything. We're Review Renew ACLS, and we're right here in Orlando. You can phone us at 407-329-8346. ReviewRenewACLS.com, and you can access all of our course details right there at your fingertips. Thank you very much.